This is Reetu Mukherji, one of the GI medical oncologists at Georgetown and the Ruesch Center for the Cure of GI Cancers. Today, I'll be talking about the Stellar 303 study, a large important study that was presented at ESMO and published in the Lancet just a few days ago. This was a large global randomized phase 3 study evaluating a novel combination of immunotherapy and targeted therapy in patients with metastatic colorectal cancer whose cancers had progressed on prior standard of care therapies like chemotherapy, anti-VEGF, and anti-EGFR therapies. And very specifically, these patients were mismatch repair proficient or microsatellite stable patients enrolled, a group that's traditionally been very difficult to treat with immunotherapy, immune refractory, especially those with liver metastases, which is seen in many of our colorectal cancer patients. The study enrolled patients and randomized them one-to-one to an experimental arm with Zanzalintinib, a novel tyrosine kinase inhibitor with multiple targets in tumor growth, angiogenicity, and immunogenicity, combined with atezolizumab, an immune checkpoint inhibitor, versus regorafenib, the standard of care tyrosine kinase inhibitor that we use, which is also multi-targeted, but with a slightly different targeted profile. Over 1,300 patients were enrolled, and after a median follow-up of 18 months, the median overall survival, the primary endpoint, was met and improved at 10.9 months in the experimental arm versus 9.4 months in the standard of care arm, with a delta of 1.5-month improvement with the experimental therapy. And this benefit was seen across most subgroups, including those with and without liver metastases and different mutational profiles like RAS mutated and RAS wild type. Response rates were still low, about 4% versus 1%, but over half of patients had some degree of benefit with disease control. With this efficacy, however, did come higher rates of toxicity. There was about a 23% absolute increase in the rate of grade 3 or higher toxicity, largely hypertension, diarrhea, and proteinuria, which we see with our tyrosine kinase inhibitor profile. Certainly, while this study does show some modest benefits in survival coming with higher rates of toxicity, it represents a positive step forward in the field for colorectal cancer patients. This is the first randomized phase 3 study that has shown a survival benefit with an immunotherapy combination in this disease population that's been very difficult to treat with immunotherapy previously. And so while this may represent a novel approach and a chemo-free approach in a heavily pretreated population, it otherwise certainly represents a treatment approach which we can build upon in the future to try to increase the efficacy of these drugs and mitigate toxicity. And we really look forward to some of the additional data and analyses, especially in subgroups that may come from this study in the future.